Hi everyone, I'm Diana Dixie and I am going to share with you my presentation on technology and nursing administration. The location of this presentation occurred at Krause Hospital or Krause Health in Syracuse, New York, where the mission is to provide the best in patient care and to promote community health. Krause has been caring for generations of families for more than 130 years. They offer a full range of general and specialty care, along with inpatient and outpatient services and community health education, along with outreach programs. Throughout more than a century of changes, the vision has always been to serve the community, to be a leading healthcare provider in Central New York through service excellence, a dynamic work environment, building on the centers of clinical and organizational excellence, innovation and collaboration, and financial and resource stewardship. The Krause values are not just words on papers, they provide the framework for how we as a team provide care and services to our community. There are tools to help us work as a team, to guide us, to problem solve, and to challenge ourselves constructively with one focus always at the forefront. Our Chief Information Officer. Kim serves as the Chief Information Officer for Krause Health and its affiliated entities, including Krause Medical Practice and Community Memorial Hospital in Hamilton. In her role as the CIO, Kim works with senior leadership to provide vision and strategic direction in the continued development and implementation of Krause's system-wide health information technology operations, as well as developing capability to enhance information sharing between Krause and physicians in the community. Rose has provided leadership and direction to the hospital's IT department since 2012, overseeing numerous major technology initiatives, including converting the hospital's legacy electronic medical record system to Sorian and replacing the physician's practice system with Medent. This is Katie Shepard. She is the Director of Risk Management and Corporate Compliance. Krause Health is committed to providing the best care, and one of the many ways we do is through our corporate compliance program. Our team works to ensure that Krause complies with the various federal, state, and local rules and regulations governing healthcare organizations. Through the program, it's designed to prevent and detect fraud and abuse based on these regulations. It also has primary responsibility to ensure that we foster an environment where patient safety and confidentiality are top priorities. Katie Shepard has been named Director of Risk Management and Corporate Compliance at Krause. She serves as the Compliance and Privacy Officer and has been with the hospital for 16 years. Katie holds a degree from SUNY Polytechnic Institute, and she holds certifications in Registered Health Information Administration and Healthcare Compliance. Katie is an active member of the Central New York Health Information Management Association, the Healthcare Compliance Association, and the American Society for Healthcare Risk Management. This is Dr. Michelle Bodie. She is our physician informaticist. Dr. Bodie is a neonatologist in Syracuse, New York, and is affiliated with Krause Hospital. She received her medical degree from Geisel School of Medicine at Dartmouth and has been in practice for over 20 years. She's board certified in pediatrics and neonatal perinatal medicine. Dr. Bodie is the medical director of clinical informatics at Krause Hospital in Syracuse and the attending neonatologist with the Neonatal Associates of Central New York. So what is the purpose? So the EHR has the ability to exchange health information electronically and can help you to provide a higher quality and safer care for our patients. Through the use of the EHR, providers better manage care for patients by providing accurate, up-to-date, and complete information about the patients at the point of care. With quick access to patient records and securely sharing electronic information, patients will benefit. The widespread adoption of the electronic health record was a result of the American Recovery and Reinvestment Act of 2009, whose major goal was to improve patient outcomes while reducing healthcare costs. The Centers for Medicare and Medicaid Services are responsible for providing incentives to hospitals, other institutions, and eligible healthcare providers for meaningful use of their EHR. When transitioning into Sorian from our previous EMR, it was a very gradual process. The initial go live with the system was just the foundation, and then the other functions were added in over time. The original timeline from install work to full integration was a 2-year period. An article from the Urology Times mentioned the importance of not underestimating the time needed to prepare building templates, making decisions, and transferring information. If also changing practice management systems, it's important to devote much more attention to training and preparation. The foundation started with Sorian Clinicals. It then moved into CPOE, then to clinical documentation, a workflow engine, the ED tracking board, critical care, the use of MAC, ePrescribe, and exit care. 3 interviews were conducted for this project. The first was with Kim Rose, who is the Chief Information Officer. When beginning the journey to identify a new platform to transition to, Kim mentioned it took about a year and a half to find something that was in line with the organization's mission. She made sure to mention that staff from all points of care were involved in this process. Kim expressed that she feels there are far more advantages to the system than disadvantages. One specific item that she was excited to mention was the nursing service workplace. This is a centralized place within the EMR that allows for nursing to see actionable items. Kim mentions how she believes this will assist in our transition away from paper SBARs. By moving towards this, nursing will increase patient outcomes and have less chance of errors. Kim also has been pleased with the EMR and how it has removed inefficiencies so that nursing can focus more on the patient. The second interview conducted was with Katie Shepard, Privacy Officer. It was apparent right from the beginning of this interview process with Katie that she doesn't feel as though there are many advantages to our EHR. From a privacy officer standpoint, Katie was very vocal about the disadvantages to the current system. What she felt was most important was the lack of ability for her to run adequate reporting from the system in regards to who is accessing what information. Katie mentioned that she has only about 20% accurate reporting on internal use. As a privacy officer, she feels this should be significantly higher. Katie also felt as though there were significant system limitations. She stated that Sorian does not speak clearly with other systems. When there is an update within, say for instance, the lab or the PAC system, information does not cross over. Another system limitation that our privacy officer felt strongly about is that from a risk perspective, there are an excessive amount of places for people to document. This can cause challenges for providers, other health clinicians, and for legal matters. Katie went on to mention she feels that organizationally we are protecting our patients' information well with the system that we have in place through the use of firewalls and encryption. Dr. Michelle Bodie, physician informaticist. Dr. Bodie was the most passionate about the system when interviewing her. She explains how the EMR impacts delivery of nursing care and outcomes through several different ways. With the reporting capabilities, data is able to be extracted and compiled into actionable items for nursing. She is most proud of having all provider documentation now within the EMR. This resulted in more efficient handoff between all clinicians and members of the interdisciplinary team. Dr. Bodie felt as though the inefficiencies within the system are that we are not utilizing it appropriately or to its greatest extent. As related to nursing, she felt as though the amount of nursing documentation within the assessments is too excessive. Dr. Bodie felt that if we did have a nurse informaticist, one thing that she would like to see done would be to know how much of the assessment does nursing truly utilize. This slide shows meaningful use. So from the interviews with the CIO and the physician informaticist, it was confirmed that the organization has attained both stages 1 and 2 of meaningful use. Within the EHR, we are able to continually collect data for reporting on meaningful use through the use of hard stops within the system. One of the best ways to ensure organizations are taking full advantage of the benefits of the electronic health record is to achieve meaningful use. By achieving this, organizations can reap benefits beyond financial incentives. This slide just shows the stages, meaning use stage 1, stage 2, and the timeline for when those were met. The CIO identified 4 technological innovations that she wanted to share. The first being the ED lab label printer system. In the emergency room, all patient rooms now have their own designated printers. This allows patient lab labels to print directly within the room and reduce the chance of an occurrence for wrong blood in tube. The lab label printer capability has been around for a period of time, but it was felt that we needed to utilize the technology to its fullest capability to help reduce any possible errors. The tap in, tap out, that's a no-click access cross-device communications. It works in conjunction with the single sign-on with strong authentication to enable providers to access their desktops and applications with just the tap of a badge. She also mentioned Kronos Advanced Schedule. This is scheduling a multifaceted workforce can be time-consuming, error-prone, and just frustrating. And even with the best efforts, there are mistakes that are going to occur. So moving to a self-scheduling software will help alleviate some of this. The Philips Monitoring Critical Care Patient Monitoring System is designed to help enhance patient care and improve clinical performance. This comprehensive solution fits securely into the hospital's IT environment and captures timely patient data and feeds it securely to the EMR. So there is virtually any gap-free patient data to make informed clinical decisions. This is utilized in the critical care and critical care areas. The privacy officer, her technological innovations that she thought of were Imprivata, Voicera, Barcode, and Employee Tracking System. So the Imprivata one sign-on or single sign-on solution enables care providers to spend less time with technology and more time with the patients. It does this by eliminating the need to repeatedly type usernames and passwords. Imprivata one sign-on allows providers to quickly and securely access clinical and administrative applications, which streamline the clinical workflows and drives the EMR adoption. The Voicera, this communicate and collaborate in real time directly and effectively. If you are able to gain real-time situational awareness through this seamless integration with the EHRs, medical devices, and other systems. It helps to reduce interruption fatigue. Barcoding. This barcoding technology can prevent medical errors by providing detailed and reliable information in the site of patient care. And then the employee tracking system. So with an employee's tracking solution from Identa System, it's an organization that's able to track and manage employees and assets. So employee tracking systems, also known as personal tracking software, utilize barcodes, magnetic stripes, proximity, smart credentials, or RF-enabled ID badges. So this technology is nice because it helps the organization to know who's swiping into a department, who's swiping out of a department, in case there were ever needed any follow-up. The physician informaticist innovations that she selected that she wanted to talk about were the Centrax locators, the telemetry monitoring, MAC, and the OmniCell. So the Centrax locators, they're real-time location systems. They're used to provide immediate or real-time tracking and management of different things, medical equipment, staff, and patients within all types of environments. Organizationally, we use them for nursing. The staff wear them, able to know where they are within the organization, what room they're in, which patient they're with. On the badges themselves, one piece of technology that nursing felt to really want is a quick duress button. So they wear the locators, and then at any time, if they're in an unsafe situation, they're able to press that, and it directly links them to our security office, and security officers will respond. The telemetry monitoring, we have IntelliView MX40 devices. These support the ability to obtain 12-lead EKG information while continuously monitoring the patients. With up to 5 different screen formats, we have the capability to readily watch our patients' rhythms with a single touch. The MAC system, the Siemens MAC, is integrated with Soaring Clinicals for the orders, medication administration, and tracking. It also stores the discharge MAR electronically and creates a downtime MAR in the event of Soaring Clinicals or Siemens MAC system downtimes. This is really important because, you know, all of our patients' medication administration is stored electronically. So when the system does have an interruption, which they do have interruptions and they go down, you have to be able to pull the information to know when a patient last was dosed with a medication. Just because the system is down and there's no computers, the care cannot stop. So having the capability to print downtime medication information is very important. It helps improve patient quality and outcomes. The OmniCell, it's an automated dispensing cabinet that deploys the latest hardware and technology and creates safer, more efficient medication process. It's a nurse-friendly cabinet. In the future, to further streamline medication management, we provide advanced integration with key electronic health record systems. In conclusion, I found this project to give me additional insight into the importance of disciplines working together to streamline our organization's health information technology processes. Integrating a new EMR into the organization was a large task, and there needed to be significant support to ensure that patient care was not interrupted. From each of the interviews conducted, all disciplines mentioned that they believe our patients are benefiting from the EHR. Nursing workflow has been streamlined, allowing for more time to be spent with our patients. Patients' health information is readily more available and shareable between clinicians and provides stronger continuity of care. Organizationally, there is significant technological support to ensure that we are striving to use the system to the fullest. This is a video, just a little clip I added in about the EHR versus the EMR. You can watch it on your time. And then looking back over the time spent with each of these individuals, I had the opportunity to gain a new appreciation for all of the work that is continually going into our EHR. Not being an IT individual, I was unaware of the continual maintenance and upgrades that are being done on our system. I also realized that I took for granted the amount of technology that surrounds us each day. Really, when sitting with these 3 individuals, they could have rambled off probably 50 different things that we walk past each day and use in healthcare as one of the technological innovations. One thing that I continue to amaze me is how that have made it so that each of the different systems have the capability to speak with each other and share information. Each of the individuals that I met with have the same common theme, that their underlying goal is to continue to improve the system's functions so that we as an organization can provide the highest quality of care. Nursing administrators need to be informed and competent in the area of health informatics because they have the capability to speak on behalf of all others. Nursing administrators have to understand the workflow of the direct point of care staff and be able to understand the technology being presented to us so that we may provide the best possible care to our patients. And the last 2 slides are just